Hi, I'm Lindsey. I'm the video editor.
I'm Sydney, and I was the videographer and narrator.
Hello, I'm Amani, and I'm the clinician in the video.
Before seating the patient, the clinician needs to place on the clinical lab jacket. She then needs to place on her mask and then her loops. After placing her loops, the clinician needs to perform a thorough hand washing. Then place her gloves. After seating the patient, the clinician then places the patient's bib on first and then the patient's safety glasses. The 204S has 2 cutting edges on each side, 4 total. It is used for supragingival gross calculus slightly below margin, medium to large size calculus. Do not use on curved root surfaces. Working on the maxillary arch, tilt the patient's head up. Place the light at an angle. Working on the mandibular arch, have the patient tilt their chin down and place the light directly above.
When positioning the patient, you need to make sure that they are at elbow height. When using the 204S, the modified pin grasp is used.
When selecting the correct working end, keep in mind that for posterior teeth, the incorrect working end will have the functional shank going across the tooth. For the correct working end, the functional shank will be parallel to the distal surface of the tooth. The 204S is designed for use on posteriors, but may be used on anteriors also. Always keep the tip 1/3 on the tooth surface at all times. Tilt the lower shank slightly toward the tooth surface to establish correct face-to-tooth surface angulation. Tilt lower shank to 70 degrees between face and tooth surface.
Overlapping strokes are used while maintaining adaptation of the tip third of the cutting edge to the tooth surface. The clinician needs to maintain a rocking motion with their wrist to initiate overlapping strokes. Check progress by using the Explorer and making exploratory strokes around the tooth. The 204S is not intended for anterior teeth but can still be used for them. When determining the correct working end for anterior teeth, the terminal shank needs to go across the tooth surface. To initiate calculus removal strokes, press down with your fulcrum finger and apply pressure against the instrument handle with the index finger and thumb to create lateral pressure against the tooth surface. Relax fingers between each calculus removal stroke. The distal surface is completed first, beginning at the distofacial line angle and working onto the distal surface. Continue making a series of short, precise calculus removal strokes. If direct vision cannot be obtained, use the mirror for indirect vision. Transillumination is used by reflecting the light source through the anterior teeth. This is used to determine if there are any carious lesions.